Are you happy? If you're happy and you know it, clap your hands. If you're happy and you know it, clap your hands. This is an experiment I'm doing as part of the science I'm teaching you about. It turns out if we're going to do the experiment right, it's not me singing and us clapping, it's us singing and us clapping. Should we take it from the top? If you're happy and you know it, clap your hands. If you're happy and you know it, clap your hands. If you're happy and you know it, and you really want to show it, if you're happy and you know it, clap your hands. Now here comes the science. Are you happier than you were 2 minutes ago? Yes. On average, that ought to be true. If not, then the hook is coming out for me. Happiness is measured in many ways. That is one, and you knew exactly what I was asking you when I said, are you happier than you were 2 minutes ago? And I was speaking, obviously, to the emotion of happiness. And that's a very important part of the bigger picture, but it's not the whole picture. When Aristotle was setting the stage for all of us who followed 2 millennia ago, he said, if you really want to understand about a good life, you have to ask someone in a reflective moment to think about their life as a whole and evaluate it. And we have now surveys around the world that do just that. These are called life evaluations, and some of them are expressed in terms of happiness. How happy are you with your life as a whole? Typically now on a scale of 0 to 10. How satisfied are you with your life as a whole? Or, and this is the particular data I'll be talking about today because it's the key question in the Gallup World Poll, which now over the last 7 or 8 years has given us essentially millions of snapshots of lives around the world. Think of your life as a ladder with the worst possible life for you as a 0 and the best possible life as a 10. How would you rank your current life? So these are called life evaluations, and they're quite different from the emotional responses. They're both important, and I'll be slipping back and forth between the two. The notion of happiness that I'm talking about really embraces both of those, but the deeper one, in some Aristotelian sense, is the one about life as a whole, because of course your emotions will be up and down. Your life indeed may be up and down, but the emotional ups and downs are within that context of a life as a whole. And the kinds of things you do for people can change both their emotions when you're doing them, but can more importantly change their life evaluations. I've got 3 things I want to do today. I'm going to take you into some of the international data and the 6 factors you've been promised to hear about. Then I'm going to introduce a couple more that don't get into the world data, but get into your daily lives. And I will be telling you that of all the services governments do, the human services are the most important. And of all the levels at which these services are provided, the closest in, the local, is the most relevant. And then I'm going to give you a set of examples about delivery of services of the sort you are dealing with to show how they could be done differently, and where they are done differently, it can make a difference. Okay, now the first thing I've been asked to do is tell you about, I already told you the kind of questions that are asked around the world. So the World Happiness Report essentially went into the science that tries to explain to people that these data do tell you something real, so that people who are, this is one more element I want to get in here, is the distinction between happiness and something bad. Psychology has been 95% measurement and treatment of depression over its first century or so of scientific research. It's only in the last 30 years that people have asked themselves, what if there were more to psychology and more to human health and more to human society than the prevention of bad things? And that if the creation of good things were taken more seriously, maybe that overall might make a different world and a better one. Fast forward to Pittsburgh. Sheldon Cohen takes some students, puts them in a local hotel, measures their positive affect before the experiment and their negative affect before the experiment. Positive affect is, among other things, how happy are you? Joy, contentment, a variety of positive emotions. The negative emotions you asked for are anger, despair, depression, and so on, a whole range of things that, by the way, your GP normally will ask you about in that second group. Did they ever ask you about the first group? Not yet, but watch this space. We're working on that. So they measured positive affect and negative affect of these students before the experiment. Then they injected them all with a variable amount of a placebo or rhinovirus, a common cold germ. And then they followed over the succeeding 10 days whether people acquired any symptoms of the cold. If so, did they have symptoms of the cold? And they followed them down to the tiniest microgram of mucus. And they found, I think by now they were maybe expecting this result, but they found it very strongly, that whether you got the cold and how bad the cold was tightly related in a dose-response relationship to the extent of your positive affect at the time you were exposed to the cold virus. Whether you had negative affect or how much you had the right sign, if you were less depressed, you were a little less likely to get the cold, but it was much weaker relationship. The real power of your system's ability to withstand the onslaughts of fate is the degree of positivity that you have in your outlook and your feelings about life as a whole. And now we get a whole sequence of research that's gone on in the same vein in the current World Happiness Report, which is freely downloadable from the web. If you Google it, you'll find a very nice chapter by Ed Diener, who was really the founder of positive psychology with Seligman, in which they've talked about the objective benefits of subjective well-being. So they're surveying the vast literature there now is about how subsequent lives go better for those who have higher degrees of positive subjective well-being, and they succeed more in their careers, they do better jobs, they live on average several years longer, from the famous Nun study, but there are many other studies of this sort, and as advertised are much less likely to get colds and much worse things. And of course it feeds back, right? People who are healthy are happier, as well as people who are happier then become healthier. Now that's a problem for a scientist, but it's not a problem for you, because it's saying if you can enter into the equation at either of those spots, you're starting a circle that's got a positive feedback. So there's a much greater impact of positivity than previously, and so at the same time as we are now measuring life evaluations around the world, we're looking at what makes for better ones and emphasizing more the importance of the positive factors. What are the 6 factors? Well, take it from the top. Now, these are the 6 factors that turn up top in the Gallup poll. I mean, we have information from the Gallup poll or elsewhere to allow their assessment. A couple of governments have officially objected to the rankings in the world poll, arguing that somehow the research was distorted. But the beauty of what we were doing is simply reporting people's own answers about the quality of their lives. There's no room for the researcher's judgment to come into play. Where the researcher's judgment can come into play is when we take these data and try and explain why people are happier in some countries than others, and we're using the available data and using our judgment as researchers. So at that point, someone can complain and said, well, maybe you should have taken account of X and you didn't. The 6 factors we've taken into account are ones that we were able to get good data on at this worldwide level, 150 countries. And so they're not quite the whole story for the reason I've already advertised, that it doesn't emphasize the local in an important enough way, and I'll come back and do that for you. The 6 factors, here they are, and they all have parallels in the kind of services you deliver all the time. One is income, and another is healthy life expectancy. And those are standard in any measure of well-being around the world, so they don't require any extra comment from me at this time. The ones that are newer in terms of development discussions, or indeed policy discussions generally, are much more related to the social. The most important factor these 6 is answers to a question: if you had trouble, in times of trouble, do you have a friend or relative you could call on? Well, in most of the countries we live in and are like Canada, the average is around 95, 96, 97%. It's very unusual to have somebody who has nobody to count on in times of trouble. There are countries in the world where that proportion of people who could say, yes, I do, is as low as 50%. It's enormously important for individuals and across nations that people should feel that they can count on one another. I'm a terrible speaker for putting in footnotes as I go. So I've taken you down 3 factors. I've got to come back and give you 3 more. But the importance of someone to count on, there's a lovely footnote about it. We've got a paper where we're analyzing what the financial crisis of 2007 on did to happiness around the world. So we do have a big box in the World Happiness Report where we look at the worst affected in happiness countries of the crisis: Greece, Italy, Spain, and Portugal, and show that their happiness fell by much more than you would have predicted from their rather big income drops and unemployment increases, because the other 6 factors also fell. The other ones in the 6 factors fell. But then, since we wrote the report, we've since said, well, now maybe we should look at the other side of the street. And so we looked at 2 countries that were very seriously affected by the economic crisis, in fact, almost the worst in terms of the banking desolation they faced, and that was Iceland and Ireland. But Iceland and Ireland, the happiness dropped almost not at all. And why do you suppose that was? It's because there's a phenomenon we've noticed around the world, that when people are in some bad times together and they share each other's interests and care about each other, sometimes what seems like something awful is in fact a chance to work together, and after they've worked together, they now realize they had more community than they thought they had, and they can emerge almost as strong or even stronger. And so that was the case. And if we ask around the world, why did I put in this footnote here? Because Ireland and Iceland are the 2 top countries in the world in terms of the proportion of people who answer in times of trouble, do you have somebody to count on? Those are the kinds of societies and communities that can have a disaster and not make it as something that fractures the community, but something that makes the community coalesce. And I'll be trying to emphasize this at your own particular interests in a moment. So we've got 3. What are the other 3? There's the general question of trust is enormously important. People love living in a place where they do not have to watch their backs. And there's a positive component of this too, where in fact they think that other people actively will look out for them. So we have these experiments about dropping wallets around the world. Are they returned? A big difference across the world if you drop wallets in major cities, with money in them, whether the wallet would be returned or not. We now have asked questions about how likely people are to return a wallet in the Gallup World Poll and in a number of big Canadian surveys. And so we can compare the 2. Well, it turns out to be very interesting. We know that trust really matters to people. People who live in communities where they think other people can be trusted are very much happier than those who don't. And we also know that by and large, people are right to be trusting or not, that in the high trust communities, actually more wallets are returned. So the highest trust countries, or think of Helsinki or Oslo, all the wallets were returned when they were experimentally dropped by the Reader's Digest. So we now have surveys, and we know all across Canada how likely people think their wallet is to be returned if found by a neighbor or a police officer or a stranger. Highest for police officers. Strangers, the probability is higher in smaller towns than in big towns. That will be understandable to you. When I was talking about this stuff in Halifax a few years ago, and I asked the audience, what would you think if somebody gave you a finger in traffic? That's a technical term. And they mused a bit, and the fellow put up his hand, and he said, that'd be someone from out of town. And you get the point. In the small community, the wave is the normal thing in traffic. In big cities, it can turn around. So it's easier to have this kind of human connection in small communities, and it really matters. But nonetheless, people are surprisingly trustworthy in large cities, and so what's frayed is our sense of trust much more than the rationale for that trust. Now, it's really important because you're shooting yourself in the foot if you're living in a trustworthy society and you're untrusting, right? Because we know it's that feeling trusting and being right about it that makes you happy. But if you don't trust your neighbors and they're trustworthy, then think what you're losing. A whole lot of happiness for you and a whole lot of happiness for them. So we finally were able to get some evidence relating actual wallet returns, because the Toronto Star went out, bless their hearts, and dropped 20 wallets in Toronto. Well, we already knew from the survey that the average expected return of a wallet if found by a stranger, which these wallets were, in Toronto is 25%. How many of the actual wallets dropped in public places do you think were returned with the money? Well, you know it has to be higher than 25, given the story I've told you. Go on, 80%. Now, if you do the statistics, even though that's only a 20 wallet sample, there was one chance in several billion that the reality people think they're living in is not wrong compared to the actual reality. In other words, the world in Canada right now, even in its busiest, most turned up parts, is much higher, and its justified trust level than people think it is. So that's a big lesson, right? Because it really means don't just take the headlines and the bad news stories seriously. That's been culled out of a reality that is much still, despite all these disconnections and faster paces of life, still much more tightly connected and positive than you think. And of course, that then will allow you to let the kids walk to school. It will make you have conversations on your next elevator ride. It'll turn a whole lot of aspects of your personal life around once the light goes on and you say, you know, these are people who'd like to talk to me and I'd like to talk to them. These are people who would return my wallet if I dropped it. I might as well make friends with them now. Okay, what are we missing? We've got the two economic, the health and the income at the first. Then we added the social support. Then we added the trust. Now we've got two more which don't so often appear. One does. We have talked corruption and trust. I link those together. It's measured by corruption in the data we have got. I've told my story with respect to trust. The others are freedom. Do you have freedom to make your key life choices? Now, you think about all the human services you provide. You want to think all the time that those people receiving those services want to feel that the decisions are theirs, the life choices are theirs, that there are options for them, that they are involved in making those decisions and responsible as well. Very important. And finally, and this is very tightly linked to it, not only are people social, as at least three of these things have indicated, they are pro-social. So we simply asked around the world, have you given money to someone else or a good cause in the last 30 days? The international differences in that are strong determinants of international differences in happiness. People like, at the individual level, being generous, and they like even more or as much living in a society where other people are generous too. And of course, the wallet return thing is really a mixture of trust and generosity, right? Because you could be perfectly trustworthy and still let the wallet sit on the pavement because you were busy and late for work. You weren't doing anything wrong or untrusting, but you weren't stepping out of your regular life with an act of generosity and picking up that wallet and trying to help somebody else. So we've got those 6 factors. And now I'm supposed to tell you in my title, how does Canada fare? So I do have a slide. I've got a whole lot of slides here, most of which are drawn from the World Happiness Report. But since you can see that on the web, I'm not going to show them to you now. But I am going to show you one. which then says, how does Canada fare? You may or may not be able to read. I've told you the 6 factors. What this does in the the top Nordic countries, because in fact Canada is number 6 in the current world rankings, and the top countries are essentially all from the ones above us. Of the top countries are all from Northern Europe, with Denmark traditionally at the top, and joined by, in this current ranking, Norway, Sweden, and the Netherlands. Norway, Sweden, Netherlands, and Switzerland. So they're all Northern European, not all Nordic, all Northern European. So I've averaged the top 3 Nordic countries, Denmark, Sweden, and Norway, as the top set of bars there. Then I've shown Canada, and then I've shown the United States, which we often are compared to in a variety of surveys. And you can see that Canada sits in the total well-being, nestled behind the top Nordic countries and ahead of the United States, with the gap between us and the Nordic countries smaller than that between us and the United States, which I think also very high. This is very high up in the league table there. The United States is number 17 out of 150, I think, in this current ranking, having fallen from, I think, number 11 when we did the first World Happiness Report, having been hit in both social and economic terms by the recession worse than a number of other countries. So how does Canada rank? Well, one thing you should note, of course, we have that blue bar. Let me tell you the science. I'm not going to tell you very much about the science. I've got bigger fish to fry. If you're going to be at the top of this ranking, you have to be good at everything, is really what it's about. The richest country in that group is the United States, but it's only number 8 in income per capita across the world. Being top in income, they're in the top 10. The only one, I think, that's in the top 10 for happiness is Norway, that's got all that oil, but it's no happier than the other Nordic countries because it knows how to use the oil. It just takes it out of the ground and puts the money back in the bank, and it doesn't affect people's lives, so they have a high GDP per capita, but that's an accounting issue. They don't spend much more, and they don't need much more, and they know how to look after themselves and each other in the future. So it's these other factors, not just income, that are telling why people are at the top. Between Canada and the United States, why does Canada rank so far ahead of the United States when its income per capita is 20% below that in the United States? Because of the 6 factors, income is the only one where the United States ranks above Canada. So in each of those other factors, those other 5 factors, in all of them, Canada is like the small town equivalent compared to the big town. In fact, our communities are more tightly knitted, our corruption levels are lower, the people to count on is higher, generosity is about the same in the 2 countries. Healthy life expectancy is substantially higher in Canada. So that's where Canada sits in the world. So now I've done what was promised to do in the title, and now I can get to how this plays out in your lives and jobs, if I may. What isn't in these 6 factors is something we have been discovering over the years as we get deeper into the research and the experiments, is that the local trumps the more distant. Let me give you a specific example out of some survey, the work we've done from the General Social Survey in Canada. It turns out a feeling of belonging is very important. Now, it links back and forth with trust. When social trust is high, people feel they belong in the community they share trust with. When they're trusting, they're more likely to reach out and then make the connections that make they feel they belong. So there's a lot of joint determination of feeling of belonging. We know that other things equal, even given trust levels, people who feel they belong in their community are happier than those who don't. But we ask people, do you feel you belong to your local community on a scale? Do you feel you belong to your province on a scale? Do you think you belong to Canada on a scale? Well, it turns out they're all important to subjective well-being. They don't compete with one another. To feel a higher feeling of belonging to your community doesn't mean a lower one at the province or the nation. You can feel you belong to all 3, and the happiest people are those who do. But the importance is ranked by distance. So for happiness effect, the most important community to feel you belong to is your own local community. And then it's the province beyond that and the nation. Well, of course, the province is not so important in Canada, except some parts of Canada. So it's a little mixed between the province, but the local certainly dominates. And the other point, which in some sense is already in the story I've told you, is that the social trumps the material. That the quality of your connections and the social fabric within which you're operating is much more important to your happiness than is any material standard of living effect. And of course, that then tells you that what's most important in the kind of human services you're concerned with is not what the service is that's provided, but how it's provided. And so I'd like to use the remaining amount of my time giving you some examples of things I've managed to learn. Well, in the outflow of the World Happiness Report 2013, which came out in September, it's the second in the first one being in 2012, I was invited to talk to a business summit in Copenhagen. Now, the Danes are top, and this is something new for them to take this seriously, so they now are looking at it a little more seriously. But since it's something they already knew how to do, then the question is they're always interested in doing things a little better. They always like self-improvement. I was happy to go and learn lessons as I did from UC. They have very flat corporate structures. They're much more likely to share the same lunchroom. They're much less status driven. They have much flatter, not just organizational structures, but pay structures. And that's because they all agree that's the way, in fact, we create the me, convert the me's into the we. And that's, of course, leadership experts say the story of successful leadership is converting the I and the me into the we. Well, of course you can do that if the more you're all in the boat together and you do in fact talk to each other and share insights, and it's not a us and them, it's the bigger us, or if you like, the bigger we. So that turns out to be extraordinarily important. While I was there, I said, I really have to visit the Lotta Care Home. I'd like to, and they were kind enough to take me out. And why did I ask to see that? Because there was a lovely CBC documentary, which you can also Google, called Dementia in Denmark. It's about a year ago now that it was first broadcast. And of course, I'm a happiness person, so that when I was listening to this, I heard it, and you will too if you listen to it. You can hear the happiness in the voices of the patients and the staff that they're interviewing. It's just obvious. And so it was quite clear that whatever they were doing different in this Lotta Care Home, it was really working in the happiness domain. So I wanted to see, is it real? What are the secrets? And what can we learn for application here and elsewhere? So when we arrived at the care home, which is in a kind of ramshackle but very pleasant building in Denmark, some of the people were leaving. Not everyone was there. And it turns out they were all going off in their minibus to a movie with the minibus driven by the chef. And these are people who are in final stage dementia, most of them, 70% dementia. They have a mix of other disabilities, equally serious, in order to round out the community. And so they are doing things that are simply, there are no locks in this place, no set meal times. It's quite extraordinary. And how did this come to pass? Of course, I saw this actually there, and it's so nice to see it. And I sort of, coming in as a stranger, then you say, now where are the staff? Well, you don't know who the staff are, right? Because one of the first things they decided when they started this now about 20 years ago, they, the leader brought the staff together and said, what will we have to do in this establishment to make it someplace you would like to live? That's very relevant. Of course, this is as it were taking the second commandment and working it out in your daily job. And so then they thought about it in those terms, and then of course what they immediately come up with is, we're certainly going to throw away our uniforms. So there are no uniforms, so then the role assignments, you then say, well, why do I care about the role assignments anyway? These are just people who are living in a home together, and they said, we're going to make it a home. It's not an institution, it's a home. So there are candles, there are flowers, there are pictures on the walls. It looks like a shared home. And these are the pictures from last year's visit to Tenerife. I said, last year's visit to Tenerife? Oh yes, every year we take at least one holiday together. So it's the staff and all the residents go off to someplace. Is that difficult? Yeah, of course it's difficult. I mean, but it isn't, because it's fun. The whole thing is fun. So I'm sitting down around coffee with the current leader of the thing. I asked the kind of questions that people who are otherwise going to be talking to bureaucrats and skeptics are going to ask, like, how can you afford to do all this? Do you get any extra budget allocation for this? Because this is unusual even in the Danish system, and the Danish system is unusual elsewhere. And she said, oh, of course not. We don't get anything extra. In fact, most of what's fancy and expensive in the system is stuff we don't want or need anyway. They're trying to push us into a new facility where every room has got its associated bathroom. And she said, that's not the point. She said, a hug doesn't cost anything. A smile doesn't cost anything. And when you think about it, the kinds of really deep human things that connect us and help us to get through our lives more happily are in fact almost all less than zero cost, because they not only make you feel better when you do them, but they of course make the other people feel better as well. These are called positive sum things, or things what in the technical language are called positive spillovers. You do it, then other people are going to react well too when you get into these positive spirals. So with the same amount of resources, you can change outcomes dramatically. I've got one more. Science has to be set up with big data in order to be convincing, but it cannot be communicated except through stories. And so that's why at the end here I'm giving you a couple of examples just to show it's real, and then where it is done, it really works. Well, my next question to the current leader was, and this is a natural one, if this is so wonderful, why doesn't everyone else do it? I was clear it was wonderful, so the real question is, why doesn't everyone else do it? She said, that's a good point. She said, in part it's fear, because of course, when you're working with flat and open structures, and this home was very much a flat and open structure, and with more imponderables, more uncertainties, less regulated, less rule-driven, in the final slide in this presentation, which I'm not quite at yet, I mean, I'm not at the end of the presentation yet, quite. I am almost at it, actually. I've had translated the principles of the Lotte care home. You probably can't read them, they're not big enough, but you can see their insidious nature. But none of these principles are essentially more expensive than anything else, but you could see why the administration of those principles for people who are rule-based might end up posing a challenge. And of course, people get stuck in what they've already done. One more, I've got one Ontario-based elder care story, and then I'm going to stop. I'd like, how are we doing for time? I don't want to cut questions out. Am I all right? All right. 2 minutes. Well, this story is 2 minutes. We had some experiments in England where we had an elder care facility where they had an unhappy floor and a happy floor, moved it across. They wanted to see what they could do by engaging people in their own lives if they could make them happier. So the unhappy floor was asked to design their own social space in the new facility. The happy floor was professionally designed, moved across. The professionals said they'll never use those self-designed spaces because that wasn't the point, of course. They didn't meet the professional standards. But after they'd moved, the previously unhappy floor became the happy floor. Why? Their social spaces that they had together designed were used 50% more than the professionally designed other ones. Their subsequent visits to GP, any of the measures that you might normally have used aside from their happiness, were improved by this very simple intervention of just at one stage, giving them a chance to work together for the benefits of others, right? This magic combination of social and pro-social. So we brought together a bunch of people from the OLTCA, the long-term care people here in Ontario, trying to get some experiments run in Ontario. We ended up getting a little bit started in Waterloo. But at the end of the day, when we'd heard from the principal researchers in this research, I said, surely this is all small potatoes. Admittedly, these are significant effects, but the amount of real life change you can get from getting together and redesigning one social space is small potatoes relative to what we could do. What if we, for example, converted our elder care facilities from lock-up places for old people and our child care facilities from lock-up places for young people, and let those people get together and give to each other and build lives in larger synthetic families? And this dropped a jaw or two, but the woman next to me nudged me and said, I've got a story for you, so let's share it. So she did. She said, well, she was running a chain of facilities, and one of them in the previous summer was having a child care crisis because most of the employees are women, and many of them have children, and the regular child care facilities are school-based, so in the summer there's an issue. So what they did is they set up a child daycare camp in the elder care facility, and I said, oh my goodness, that must have broken a few rules, and she said, oh yes. And that's back to the other issue, of course. You have to be prepared to do that. She said, well, I said, how was it? She said, it was a wonderful success. She said one of the elements of the success was in this facility, they have a few patients known as wanderers. That'll be familiar to you. And it's, I guess, the reason why some of these places have locked doors. But she said during the 3 weeks that camp was going on, not one of the wanderers tried to wander. Well, that tells you that those people didn't have dementia in the sense we thought they had dementia. It means they knew perfectly well where home was and they wanted to go home. And when that elder care facility became home, they realized that it was home, and they stayed there. And that they were searching for home. And home wasn't in the previous facility, but home was in the current one. I'd like to turn it over now, if I may, to you for questions. Thank you.